We're also joined by Rhode Island Public Radio political analyst Scott McKay. Hello, Scott.
Great to be here, Ian.
Brendan, you're trying to separate yourself from national Republicans. One of your refrains is that you'll be your own man in Congress. But is that really a recipe for political success? Can you point to current congressional Republicans who've been effective while bucking the party leadership?
Well, I would describe myself as a John Chafee Republican. I know that my friend Scott Brown in Massachusetts has been very effective in being able to cross party lines and when he has to, and find common sense solutions to problems. And that's what I'm all about. I continue to talk about the fact that I am my own man. People that know me know that I'm my own man. There are, I mentioned earlier on, I think a few months ago on this show that Paul Ryan has some good ideas, but there's one idea that I don't agree with Paul Ryan's ideas, and that is as it relates to Medicare. I have my own ideas when it comes to Medicare. I can be an independent thinker, and but getting back to Paul Ryan, there's a lot of Paul Ryan's ideas that I do agree with, and so does President Obama. So I think we need to break this gridlock in Washington. Really, it is not healthy for this country. We need we have a two-party system, and I think we should embrace that.
Paul Ryan has a pretty dramatic vision for cutting government spending. We all know that the nation has a huge $16 trillion deficit, but he wants to cut programs that mostly benefit the poor and middle class and cut taxes for the wealthy. Are you comfortable with that vision?
Well, Paul Ryan talks about cutting the corporate tax rate, and which I'm a big believer in. We have the highest corporate tax rate in of all industrialized nations, and we need to grow jobs here. We don't want to penalize our small businesses. We have 93,000 small businesses here.
Okay, the question was whether you're comfortable with that the vision offered by Paul Ryan.
Well, there are other things he talks about, dropping the marginal rates and consolidating brackets. So there are some things that I really think he's a great thinker, Paul Ryan. But there are other areas where no. For example, programs for children. I've spent most of my career helping kids and helping seniors. I want to make myself very clear that I think that we should not touch Medicare right now until we can overhaul the entire health care system and work that in and make Medicare stronger for our seniors, as well as Social Security. Our seniors played by all the rules, and our seniors should be safe on Social Security.
Let's go to Scott.
The Affordable Health Care Act, so-called Obamacare, Romney Care kind of it was based on, but Republicans have said, as an article of faith, they want to repeal the entire act. How do you feel about that?
Well, I think that no. First of all, I don't think we should repeal the entire act. We need to modify it. If Governor Romney is the president in January, I'm sure that they know they need to come up with a better plan. There are great ideas in the Affordable Health Care Act, like the 26-year-olds, the donut hole, the pre-existing conditions. Those are things that are important to Rhode Island. As a 26-year-old, for example, my daughter just graduated from college last year. It took her an entire year to find a job, but some of her friends don't have jobs, so they are able to be insured under their parents' plan. But our health care needs to stand the test of time, like Social Security and Medicare did. Well, I truly believe we need a bipartisan commission to sit down and strengthen that. We didn't address tort reform. We didn't address efficiency in health care. We need evidence-based standards of care. We need to be able to have portable health care to be able to travel over state lines. It needs to be portable so that our American workers can leave one job and go to another and still appreciate and enjoy the same health care.
Brendan, is Mitt Romney correct to accuse President Obama of being, quote, disgraceful and sympathizing with those responsible for the attacks this week in Libya and Egypt on American personnel?
Listen, I think we need to be very vigilant in what's happening in Libya and in the Middle East. We have so many difficult situations in this country, including the issues with Iran and Israel. And I'll get to that. And, my first thought is we need to make sure that the American citizens in Libya right now are safe. There are still American citizens there. And I don't think that the dialogue back and forth between the president in Governor Romney is something that I want to comment on. I just think that we need to make sure Americans are safe over there. It's a terrible act of violence, and we need to respond to it.
David Cicilline's only been in Congress for a little less than 2 years, but he's taken 1,500 votes down there. Can you give us an example of some of those votes that you think are wrong and you would have gone the other way on?
Well, let me give you an example of one, the medical device bill that he voted on. That is, we have medical device companies right here in Rhode Island, so that would tax these medical device companies, and all it does is hurt Rhode Island business, hurts American businesses, hurts Rhode Island businesses.
But wasn't that a key part of the Affordable Care Act that you needed to finance the whole thing?
So we're going to finance it on the backs of hardworking Rhode Islanders? No, I don't agree with that. I've traveled throughout the First District and manufacturing companies, and they've told me that that's just a job impediment. So I believe if we need to finance it, we need to find other avenues, and that's something that we didn't address in the Affordable Health Care Act. The individual mandate is killing a business right now.
One of the arguments David Cicilline is making that his views are more in line with those of voters in the 1st Congressional District than yours. How do you respond?
I'm sorry, say that again?
David Cicilline says that the issues he fights for and his stances are more in line with the voters of CD1 than where you stand.
That's a great question, because it's a disingenuous comment that the congressman is making. Listen, I continuously talk about Simpson Bowls and bipartisan solutions to our problems here in America and our problems here in Rhode Island. Congressman Cicilline is from the Progressive Party. And let me tell you, 108 of 155 Democrats voted against the budget that Congressman Cicilline tried to push. So he talks about the radical Republican agenda. I think voters need to know about the radical progressive agenda that David Cicilline, he's far to the left and I'm to the center.
One of the things that talk about the individual mandate, how do we get the Affordable Care Act to work without the individual mandate?
Well, first of all, let me restate what I said earlier. I said that I believe I said it's killing businesses. It's not. It's a job impediment, because a company that has the mandate for 50 employees or more, some of those companies are not hiring now. I've spoken to them, Scott. I've constantly traveled throughout the First District. Companies that have 40, 45 people, they're not hiring, even though they can, because they're afraid of this right now. I really believe we need a bipartisan solution to this.
Now, wait a minute. Massachusetts has had these individual mandate for, 5, 6, 7 years now. 20 miles away, those people are hiring. The unemployment rate in Massachusetts is 6.2%, and they have universal health care. What are we doing wrong?
Well, that's a good point, that Massachusetts has a low unemployment rate. So
their economy is better than ours, and they've had universal health care now for years.
Yeah, but that's not because of universal health care. That's because...
obviously, then universal health care is not the drag on their economy.
Well, yes, it may be a drag. It may have been a drag early with the business community. Listen, we have 93,000 small businesses here in Rhode Island, and we want to grow jobs. And from what I'm told from talking to the members of the business community, those small businesses are not hiring right now because they're afraid of the affordable health care. Because it doesn't exactly mirror what you're talking about, the Massachusetts program.
Pretty close.
I'd like to come back to Medicare. Medicare is one of the big cost drivers in the federal government. You say you don't want to cut the program itself. You want to try and go after the cost of health care. But is that really realistic to think that the cost of health care for Americans can be brought down in time to put Medicare on a sustainable footing for the future?
Well, I talk about Medicare as far as I liken it to a boat in the middle of the ocean that has a rip in the sail, and that's Medicare. And we're up there fixing the sail, and then someone tells us that there's actually a hole in the boat. So we need to fix the hole in the boat before we go back up to the sail. That Medicare, there's a lot of pieces of Medicare they should be able to get the cost of the drug program down. We should be able to find more efficiency. One thing I want to attack in Medicare is the $48 billion in fraud. We allowed $48 billion in fraud in Medicare in 2010. That's like a bank president coming in and saying we're running in the red, and someone raises their hand, one of the employees, and says, "Well, we have a bank robbery here every week," and no one does anything about it. So, from my background, that's something that I'll shine a light on in Washington.
We're out of time, so I have to leave it there. Thanks for joining us, Scott.
Thank you, Ian.
First Congressional District Republican candidate Brendan Doherty.
Thank you very much for having me.